We're going to talk about the main requirements of the emergency temporary standards. We're going to talk about important revisions to the emergency temporary standards. And we're going to talk about those revisions, specifically the ones that went into effect on May 6th, which are in effect right now. We're also going to talk about how to investigate and respond to COVID in the workplace. We're going to talk about the return to work criteria for COVID cases and close contacts, which is ever changing. So we need to know what to do now. And we're going to talk about how to handle multiple COVID infections in the workplace, as well as handling a major COVID-19 outbreak. We'll talk about exclusion pay under the emergency temporary standards, and also 2022 COVID-19 supplemental paid sick leave. So that's our agenda for today. We'll be talking for at least a half an hour, if not a little bit longer, and then we'll have plenty of time for questions. So if you can hold your questions till the end, we'll get to all of them. So what are the emergency temporary standards? It's kind of like a term that we probably don't hear every day, but Kayla and I do. So emergency temporary standards, we call ETS, and that's a set of uniform rules created by the California Department of Occupational Safety and Health, also known as Cal-OSHA. And that regulates the COVID-19 prevention and the mitigation of outbreaks in the workplace. And it's really very important for us to know that it's workplace related. Cal-OSHA dictates workplace safety in California. So when we talk about ETS, we're talking about California, and we're talking about workplace. So the ETS applies to all California employers, employees, and places of employment, with a few exceptions. So those exceptions are the work location where there's only one employee who does not have contact with other people. So let's say we have like an accountant that goes into an office and they're the only one there, then they would not have to follow standards at work if there's no interaction with other people. Or if you have employees who are working from home, those people do not have to comply with the emergency temporary standards. Employees who are covered by the aerosol transmission diseases regulations, and the reason why they don't have to comply is because they have a whole their own set of regulations that they have to comply with. And also exempted from the ETS are employees that work from a location chosen by the employee that's not under the control of the employer. For instance, if an employee is working in a cafe or at their friend's house or some remote location of their choice, then they do not have to comply with the ETS. So the ETS has undergone an evolution since the lockdowns began in March of 2020. Now, it was certainly right after the lockdowns began, Cal Work Safety and HR, we started working with our clients to develop COVID prevention plans. However, Cal-OSHA did not enact an official emergency temporary standard related to COVID until November 30th of 2020. So at that time, all employers were required to have a COVID prevention plan in the workplace and have all their employees under that. And that is the original ETS that we were under. Now, of course, Cal Work Safety and HR, we wrote COVID prevention plans that complied with that at that time. And for a full 6 months or 7 months, we were all working under those original ETS. Then in June 17th of 2021, they made minor revisions to that initial plan and they readopted it. And that second plan was in effect through January 13th of 2022. And again, the team at Cal Work Safety and HR, we updated our plan for each of our clients to make sure that everyone was complying with the new rules. And then in January 14th of this year, we had some major modifications to the plan. And that third set of ETS rules were in effect through the beginning of May of this year. And at that time, on May 6th, we had the current and third readoption of the Cal OSHA ETS, and that will remain in effect through the end of this year on December 31st of 2022. But there are a number of changes that were made this time around, and what we really have seen is some relaxation of some of the employer requirements, and we really see that we're deferring now to the California Department of Public Health on some important information to ease the conflict between the previous ETS and the California Department of Public Health guidelines that caused some confusion. So now we have some more consistency with the guidance that we're getting, and specifically what it has done is relaxed the requirements as far as what employer has to do in certain circumstances. However, most of the COVID prevention plan requirements have remained unchanged. So we're really going to kind of drill down on what is the same and what is different. So as always, the employer must develop a written COVID-19 prevention program or ensure that its elements are included in the existing injury and illness prevention program, which all employers are also required to have in California. Although at CalWorks Safety and HR, we do recommend having a separate COVID prevention plan, separate from your IIPP, just because of the changes that occur so frequently. But if you do have it rolled into your IIPP, that is okay. So the main requirements of the Cal OSHA ETS, we must do the following in accordance with our written program. First of all, we do need to communicate to employees about our COVID prevention procedures, what we as an employer have put in place to protect our employees from COVID in the workplace. In addition, we have to put in our written program how we have identified, evaluated, and corrected COVID hazards, whatever they may be, in our workplace, specific to our industry, specific to our workplace. Then we also include in our written plan the fact that we require and provide face coverings and respirators in the manner and circumstances specified in the ETS. And because the ETS is changing, what we put in our plans now is that we will comply with the ETS as far as what we provide to employees for face coverings and respirators. We also will put in writing that we will investigate and respond to COVID-19 cases in the workplace. We'll also take infection control measures, such as providing PPE, personal protective equipment, to our employees. And then we describe our exclusion requirements, meaning isolate, quarantine, testing, all of the return to work criteria that we follow in compliance with the California Department of Public Health. And we also provide COVID-19 training to employees. We don't just have this plan, but we actually discuss it with our employees and make sure they understand what the plan is, what our responsibilities as an employer are, what their responsibilities are as employees as far as reporting, complying with the plan. And we get them to sign off on that training so that we have proof that everyone has been trained on each version of the plan. Also written in our plan is the fact that we will make testing available at no cost to the employees that are eligible for testing, COVID testing, and also the fact that we will maintain COVID-19 records of cases that we have, and that we report serious illnesses and outbreaks to Cal OSHA and the local health department when required. Next slide. And we will talk about eligibility for tests, who's eligible. I think that's Kayla's slide. Now, as far as revisions, the new things that we have to comply with now that we have an updated emergency temporary standard as of May 6th. One of the things that have been updated in the emergency temporary standards is the definition of face covering. In January, that version of the ETS stated that a compliant cloth mask was required to not let light pass through when held up to a light source. So employees were required to hold their cloth masks up to the light, and if you could see light going through the mask, then it was not compliant. So we no longer have that requirement for cloth masks. However, a cloth mask still does need to be a tightly woven fabric, or if it's a non-woven fabric, it does need to have at least 2 layers. And also an update is that face covering requirements are now the same for all employees, regardless of vaccination status. So we used to differentiate between vaccinated and unvaccinated as it relates to mask wearing. And so now we treat employees the same, whether or not they're vaccinated. And Kayla will discuss more about that. Or I think I will on this side. Let's see. So another change, and we all remember back on March 1st when Governor Gavin Newsom issued an executive order updating the ETS to align with the California Department of Public Health guidance on face coverings while in indoor locations. And that was really as a result of the rate of transmission at that time. And he felt it necessary to go ahead and lift that mandate. So in compliance with, or in alignment with the California Department of Public Health. So no longer was that mask mandate statewide for indoor locations. And as of this date, today is June 16th, as of this date, we don't have general indoor fast food.
I'm good. I had a thought. You know, yesterday or a couple days ago, World Softball Day.
Jake, can you mute our participants,
On
please?
Saturday, I don't know what you're doing Saturday. You'd want to come take a picture with the team and we can post it for World Softball Day.
Okay, so as of June 16th, no general indoor face covering mandates exist under the California Department of Public Health. And when I say that, I mean general indoor face covering mandates, because there are a number of other instances in which the emergency temporary standards do require face coverings. So for example, if there is a COVID-19 outbreak in the workplace, and that's 3 or more people, then everyone will need to wear a face covering in the workplace. Also, if there's an asymptomatic close contact and they're pending their test results or COVID-19 test results, and or if they test negative, then they'll be wearing their mask in the workplace. And then also, if we have screening of employees as they enter the workplace, then both the screener and employees will be wearing face masks during the screening process, if they're doing that screening process indoors. And then finally, in certain return to work circumstances, you will be wearing a mask in the workplace, and Kayla will be talking about that in just a few minutes. Okay, so regarding face coverings, so as I mentioned, the California Department of Public Health, the guidance doesn't require general indoor face coverings, but it still requires indoor masking for all individuals, regardless of vaccination status, in certain indoor spaces, including, and this doesn't affect a lot of our clients, however, it is good to be aware of it in case you meet one of these criteria. The first is emergency shelters and cooling and heating centers. Those locations are required to wear masks in indoor spaces. And also healthcare settings. All healthcare settings are still to this day required to wear masks indoors. State and local correctional facilities and detention centers have the mask mandate, homeless shelters have it, and long-term care settings and adult and senior care facilities also have the mask mandate. And then also be aware that certain local public health departments also have stricter mask mandates. So for example, in Alameda County, just this week, because of their transmission rate now being so high, that has triggered an indoor mask mandate in that county. Also in San Francisco County, they require masks inside all of Department of Public Health buildings. And LA County also requires masks on all forms of public transportation and all indoor transportation hubs, including airport and bus terminals. So that's face coverings. Now respirators, also known as N95 or KN95 face masks, that's what we call a respirator. We are, as employers, still required to provide them to employees who request them for voluntary use, regardless of vaccination status. So what I suggest doing is having 1, 2, or 3 boxes, small, medium, large, or even extra large, of these respirators available for employees if they request them. Although I have heard that rarely do employees request them, but we do need to have them available. And then as far as cleaning and disinfecting, the current ETS, that one that went into effect on May 6th, no longer requires precautionary cleaning or disinfecting, meaning that we don't have to clean and disinfect daily as a precautionary measure for COVID-19, as we know now that COVID-19 is primarily airborne. And also testing and exclusion, that change now is that we're required to make COVID-19 testing available at no cost and during paid time to employees with COVID-19 symptoms, regardless of their vaccination status and regardless if there's a known exposure. Because we're operating, and it's still a pandemic, if employees have COVID symptoms, then we need to provide them with testing at no cost and during paid time. So that's kind of a big deal. That's something that we need to be aware of as employers, that we're on the hook for that. We also have to make COVID-19 testing available to employees who've had a close contact in the workplace during outbreaks and during major outbreaks. Okay, I think, Kayla, is this where you take over?
Yeah, I can go ahead.
Okay.
Okay, so we have the return to work criteria, which has been updated. The California Department of Public Health guidelines now are going to govern the return to work criteria for those who are considered close contacts to a COVID case. Before, with the past ETS, the ETS, and the California Department of Public Health guidelines, there were some conflicts, as Wendy had mentioned earlier. So now it makes it a little bit easier, and the ETS is just allowing the California Department of Public Health to control. So a close contact is anyone who is within 6 feet of a COVID-19 case for a cumulative total of 15 minutes within any 24-hour period during the COVID-19 case's infectious period. So when they say cumulative total, this means it could be 5 minutes in the morning, 5 minutes at lunch, 5 minutes in the evening before they go home. All of that would equal the 15 minutes. It doesn't have to be a continuous 15 minutes. The infectious period is defined as 2 days before one first developed symptoms until 10 days after symptoms first appeared, and 24 hours have passed with no fever, without the use of fever-reducing medications, and symptoms have improved. So for COVID-19 cases who test positive but are asymptomatic and never develop COVID-19 symptoms, their infectious period is a little different. Theirs will be 2 days before until 10 days after the specimen for their first positive test for COVID-19 was collected. Also, an update is that the definition of infectious period will change in the ETS if the California Department of Public Health changes its definition in a regulation or order. This won't apply if California Department of Public Health changes the definition in the guidance. It'd have to be a regulation or order in order for the ETS to match. So the requirements for employees who test positive for COVID-19 have also been updated to reflect the most recent California Department of Public Health isolation and quarantine guidelines. A few definitions have also changed with the new updated ETS. So for instance, now a COVID-19 test has been updated to allow a test to be self-administered and self-read, so long as the result includes additional independent verification, such as a time-stamped photograph. I know before employers were worried and it was taking up time because they had to set up like a Zoom call or a video FaceTime call to try and verify the results of their employees' COVID-19 test. That's no longer a requirement. So employers or telehealth providers no longer have to verify the results of an employee's COVID-19 test for it to be considered. A COVID-19 hazard has been updated to eliminate references to objects or surfaces that could be contaminated with COVID-19. Those areas are no longer considered COVID-19 hazards under the ETS. This kind of goes back to what Wendy was saying regarding precautionary cleaning and disinfecting. The science has shown that it's transmissional, that COVID-19 is more transmissionable through airborne. It's not really something that stays on surfaces, and that's not really a big way that people have been catching COVID. Return case is a new definition that describes an employee who has returned to work from an infection and is still within 90 days from either the onset of symptoms or the positive test if no symptoms developed. So return case is really just a definition that they've included, but the concept has always been in the ETS. Now it's just a little bit easier to read through rather than having to read that whole definition the entire time. We've just labeled it as a returned case. So investigating and responding to a COVID-19 case in the workplace. So what an employer will want to do is investigate the COVID-19 case to determine the details of when the COVID-19 case was last present in the workplace, the date of the positive COVID test, and the date of symptoms. CalWork Safety and HR has some documents and forms to help employers through this investigation process. And then afterward, you'll want to determine who had a close contact with the COVID-19 case and notify all close contacts and authorize representatives, if any. So the notification requirements are statute-based. There's certain things that have to be in the notification in order for it to be considered compliant. So the notification must be within 1 business day of the time the employer knew or should have known of the COVID-19 case. Must be in a manner that the employer normally uses to communicate employment-related information, whether this be through email or text message. Must include information about the employer's cleaning and disinfection plan. This is where things can get maybe a little confusing for employers. As we mentioned before, there's no longer a proactive precautionary cleaning and disinfection plan in place under the ETS. However, the statute remains the same with notification requirements, where you must include a cleaning and disinfection plan if you are aware that there's been a COVID-19 case in your workplace. So typically, the statute advises to follow the CDC guidance on a cleaning and disinfection plan. There are 3 different notifications that should be given out. The first one is a COVID leave notice given to the employee who tested positive. It'll go over their benefits and everything else. The second notification would be of possible workplace exposure given to those who may have been exposed. The third notification would be to close contacts, given to those who have been found to be a close contact to the COVID-19 case. So to continue the investigating and responding, you to make COVID-19 testing available at no cost during paid time to all of the following employees, regardless of vaccination status. So this would be symptomatic employees, regardless of whether there is a known exposure, those who have had close contact with a COVID-19 case, except for recently recovered employees, employees in an outbreak or major outbreak setting, which I'll define in a bit, except for recently recovered employees and employees who are not at work during the relevant period. The next thing that an employer will want to do is investigate whether workplace conditions could have contributed to the risk of COVID-19 exposure. Maybe the employer has been holding big meetings indoors where people aren't wearing face coverings, and that could have contributed to the risk of an exposure. And then what could be done to reduce exposure to COVID-19 hazards? This could be having people stagger their in and out times, their meal break times, having some people work remotely and telecommuting. So this is the new return to work criteria. This is specifically for those who test positive for COVID-19 and are required to isolate. These requirements apply to all employees, regardless of vaccination status, previous infection, or lack of symptoms. So an employee must be excluded from the workplace for at least 5 days after the start of symptoms or after the date of the first positive test if they don't have any symptoms. So the isolation can end and employees may return to the workplace after day 5 if symptoms are no longer present or are resolving and a diagnostic specimen collected on day 5 or later tests negative. If an employee's test on day 5 or later is positive, isolation can end and the employee may return to the workplace after day 10 if they're fever-free for 24 hours without the use of fever-reducing medications. So if an employee is unable or choosing not to test, isolation can end and the employee may return to the workplace after day 10. They are fever-free for 24 hours without the use of fever-reducing medications. If an employee has a fever that's still lingering, then isolation must continue and the employee may not return to work until 24 hours after the fever resolves without the use of fever-reducing medication. So if an employee's symptoms other than the fever are not resolving, then they must not return to work until their other symptoms begin to resolve or until after day 10. So no matter when the employee comes back, if the employee is coming back on day 6, then they still must wear a face covering around others for a total of 10 days. So like Wendy had mentioned earlier, this is a situation in the return to work criteria where an employee must wear a face covering. So then we have the return to work or exclusion requirements for close contacts with COVID-19 cases. For the most part, there's no quarantine. For employees who are asymptomatic, they would test within 3 to 5 days after their last exposure. And those infected within the prior 90 days do not need to be tested unless their symptoms do develop. Close contacts should wear a well-fitting mask around others for a total of 10 days, especially in indoor settings and when near those at higher risk for severe COVID-19 disease. If symptoms develop, they must test and stay home. And if the test result is positive, then they'll follow the isolation table just described. For those who are close contacts and do develop symptoms, they will be excluded and they must test as soon as possible. So the exclusion must continue until test results are obtained. And if the employee is unable to test or choosing not to test, then their exclusion must continue for a total of 10 days. If the employee tests negative and returns to work earlier than the 10 days after the close contact, the employee must wear a face covering around others for 10 days following the close contact. The California Department of Public Health does recommend continuing exclusion and retesting in 1 to 2 days if testing negative with an antigen test, particularly if tested during the first 1 to 2 days of symptoms. For symptomatic employees who have tested positive within the previous 90 days, using an antigen test is preferred. So multiple outbreak. A COVID-19 multiple outbreak or multiple COVID-19 infections is defined as 3 or more employee COVID-19 cases within an exposed group who visited the workplace during their infectious period at any time during a 14-day period. An exposed group are considered all employees at a work location, working area, or a common area at work when an employee COVID-19 case was present at any time during their high-risk exposure period. A common area at work includes bathrooms, walkways, hallways, aisles, break or eating areas, and waiting areas. However, a place where those are momentarily passing through while everyone is wearing face coverings without actually congregating in that one space wouldn't be considered a work location, working area, or a common area. So in addition to the requirements for non-outbreak settings, when there's been multiple COVID-19 infections, an employer must report the status as a multiple outbreak to their local health department within 48 hours, exclude COVID-19 cases and employees who had close contact when required, ensure all employees in the exposed group are tested for COVID-19, repeat the testing 1 week later, and then continue to make tests available to employees at least weekly until the workplace no longer qualifies as an outbreak. An employer doesn't need to make testing available to employees who are absent from the workplace during the relevant 14-day period or who recently recovered from COVID-19 and do not have symptoms. So that would be the return cases definition that we discussed earlier. An employer must also exclude from the workplace employees who had close contacts until they test negative or the return to work criteria for COVID-19 cases are met, perform a review of potentially relevant COVID-19 policies, procedures, and controls, and implement changes as needed to prevent further spread of COVID-19. This is where the controls from previously in your investigation could also come into play here. It could be telework, different options, maybe social distancing. You'd also want to implement ventilation changes to mechanical ventilation systems, including increasing filtration efficiency to at least an MERV 13, or the highest efficiency compatible with the ventilation system you currently have. So you'd also want to evaluate whether a HEPA air filtration system unit is needed in your workplace. All employees in the exposed group, regardless of vaccination status, must wear face coverings when indoors or when outdoors and less than 6 feet from another person, unless an exception in the ETS applies. So a major COVID-19 outbreak. That's been defined as 20 or more employee COVID-19 cases in an exposed group who visited the workplace during their infectious period within a 30-day period. Employees in the exposed group will either be tested or will be excluded and follow the employer's return to work requirements starting from the date that the outbreak began. In addition to the requirements for the multiple COVID-19 infections, an employer must take the following actions. Ensure all employees in the exposed group, regardless of vaccination status, are tested for COVID-19 at least twice weekly, or more frequently if recommended by the local health department. So this differs from the multiple COVID-19 infections where employees were tested at least once weekly. Here, they need to be tested at least twice weekly. Provide a respirator for voluntary use to employees in the exposed group and determine the need for a respiratory protection program or changes to an existing respiratory protection program to address COVID-19 hazards. You'll want to separate any employees in an exposed group and who are not wearing respirators from others by at least 6 feet, except where the company or the employer can demonstrate that 6 feet of separation is not feasible, and except for momentary exposure while those are in movement. You'll also want to evaluate whether to halt some or all operations at the workplace until COVID-19 hazards have been corrected. And then you'll want to take any control measures deemed necessary by OSHA. Exclusion pay. I know this can get a bit tricky, exclusion pay versus supplemental paid sick leave, but hopefully these next few slides answer some lingering questions you might have. So exclusion pay would be given to an employee who's excluded from work because of a workplace COVID-19 exposure. They'd receive exclusion pay if the employee was not assigned to telework during that exclusion period, and the employee did not receive disability payments or workers' compensation temporary disability payments during the exclusion period. An employee receives pay for the period that the employee is excluded, which is typically 5 to 10 days. 2022 COVID supplemental paid sick leave, which we'll discuss and reference as 2022 SPSL. That would be covered employees who work for employers with 26 or more employees would be entitled to up to 80 hours of COVID-22 SPSL. The number of hours given is dependent upon how many hours the employee typically works. So someone who's working part-time at 20 hours a week wouldn't be entitled to the 80 hours. There's formulas that that have been put out to determine how many hours an employee would be entitled to. Unlike exclusion pay available under the ETS, employees do not have to have been exposed to COVID-19 at work for 2022 SPSL to apply. Also, SPSL went into effect, I believe, February 19th. However, it is retroactive and applies from January 1st to September 30th of this year. And also, unlike 2021 SPSL, employers may not require employees who are excluded from work due to a workplace exposure to first exhaust their 2022 SPSL. So a covered employee is an employee who's unable to work or telework for an employer because of one of the following reasons. The employee is subject to a quarantine or isolation period related to COVID-19 as defined by an order or guidance of the State Department of Public Health, the CDC, or a local public health officer. The employee has been advised by a healthcare provider to isolate or quarantine due to COVID-19. The employee is attending an appointment for themselves or a family member to receive a vaccine or a vaccine booster for protection against COVID-19. The employee is experiencing symptoms or caring for a family member experiencing symptoms related to a COVID-19 vaccine or vaccine booster that prevents the employee from being able to work or telework. The employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. The employee is caring for a family member who is subject to an order or guidance described in our first bullet point, or who has been advised to isolate or quarantine as described in our second bullet point. Also, a covered employee would be one who is caring for a child whose school or place of care is closed or otherwise unavailable for reasons related to COVID-19 on the premises. A covered employee is entitled to additional COVID-19 supplemental paid sick leave if the covered employee or a family member for whom the covered employee is providing care tests positive for COVID-19. A covered employee does not need to exhaust the leave to which they are entitled to prior to using this additional leave. When a covered employee is entitled to additional COVID-19 supplemental paid sick leave, the amount does not have to exceed that which the covered employee was entitled to originally. For instance, a full-time employee entitled to 40 hours of normal supplemental paid sick leave for the reasons we described on the previous slide would be entitled to just an additional 40 hours of supplemental paid sick leave if either they or a family member tests positive for COVID-19. The total maximum of supplemental paid sick leave a covered employee is entitled to receive must not exceed 80 hours for the qualifying time period. So you don't have to give employees any more than 80 hours if they're eligible for that amount of time for the qualifying time period. As always, we're here to help you if you have any additional questions. We're still working through getting our clients' COVID plans updated. So please be aware if you're getting those in the future, those should be coming just because Cal OSHA makes so many updates. It's a little hard to keep up, but yeah, we've been updating all client plans and everything else. So if you have any additional questions or any kind of specific questions, you can always email us at info@calworksafetyhr.com.
One
All
thing,
right.
but Jake, before you launch into the questions, one
Sure.
thing I want to clarify as far as exclusion pay. I think we were assuming that you all remember what exclusion pay is. Another term for exclusion pay is earning continuation. And that's where an employee may be entitled to earnings and benefit continuation under the certain limited circumstances. And that is number one, if the COVID-19 exposure is determined to be work-related. And number two, if the employer is required to quarantine or isolate. And number three, if the employee is able to work, is otherwise able to work. They weren't planning on being vacation. They didn't have time off for a wedding. They were actually planning on being at work, but because of a COVID-19 work related exposure, they're now required to quarantine. And then finally, if work from home or temporary work is unavailable, then they would be entitled to earning continuation. But this does not apply again to any time period for which the employee was unable to work for some other reason other than protecting people in the workplace from the possible transmission of COVID. So exclusion pay is something that employers are on the hook for, and that would be first before supplemental paid sick leave would be used. So I hope that makes sense. Or Kayla, if you want to jump in and help explain that, because I think we're going to get a lot of questions on that.
Yeah, no, I'm glad that you cleared that up. Yeah, because I guess it's not necessarily always like considered exclusion pay, or they kind of switch the definition a bit to earnings continuation.
Okay, Jake, do you want to go ahead with the questions?
Sure, yeah. So let's see here. Our first question is what determines eligibility for tests?
Yeah, so the eligibility for tests, that would be someone who has symptoms, and it doesn't have to be a workplace exposure or not. Could just be someone who comes in and shows signs and symptoms of COVID-19. Also, those who are in the exposed groups, as I mentioned, when there's been either a multiple outbreak or a major outbreak.
Can an employer in a manufacturing setting still mandate masks indoors for employees that are not vaccinated?
Yes, in fact, because of that exclusion pay and the fact that employers are on the hook for workplace exposures, if they have to isolate employees, there is an incentive just there for that reason alone for employers to be extremely cautious above and beyond what is required in the emergency temporary standards. And by all means, you can not only require unvaccinated, but you can require vaccinated employees to be to wear masks indoors. So that would be a company policy and something that you will talk to your consultant with at CalWork Safety and HR when we write your plan. How do you feel about your risk management level? Like, what do you want to require? Do we want to require all employees or only unvaccinated employees? Do we want to require visitors? Do we want to require our customers? That's always within the discretion of the employer, what we want to require as far as keeping our employees safe in the workplace. And then we'll incorporate that into the COVID prevention plan that's customized for you.
Do you suggest we take down our mask required signs for our customers and clients and those coming into our buildings?
Well, that would depend on your position on that. So like I said, if you would like to take every precaution to protect your employees and want to go above and beyond what the ETS requires, then you can certainly require customers and clients that come into the building to continue to wear masks. And if you want to only stick with what the ETS requires, then you may not, you don't have to require that, and you can take those signs down. So it's really a decision. Do a cost benefit analysis as far as how it makes your customers and clients feel. Maybe they want that, maybe they don't. But whatever you decide, then we can write that into your plan and we can take action on the signage in your building based on what you decide.
Do you have sample letters to give positive employees and for COVID close contacts?
We have been
Yes.
writing letters for our clients, specific to, what rules that they have. It would be above and beyond the ETS or strictly compliant with the ETS, and any kind of rules that are out there. We do write them specific for our clients. And so if you, we do suggest contact your HR consultant and let us get those letters for you, because you don't want to wait until we have an exposure to try to come up with a letter. You only have 24 hours. You have 1 business day to get the notification letters out. So please work with us and let us get those letters to you before you need them. Do you have anything to add to that, Kayla?
Oh, no, that was it. I was just going to say we've been working with our clients to get the letters out, kind of customized to what they need.
How does an employee prove that they are caring for a sick family member?
Kayla, I'll let you take that one.
Yeah, so I guess that right now there isn't really anything that the employer can't really ask for proof. Some of the times that the employer can ask for proof would be if the family member does test positive for COVID, that's when the employer can ask for proof of the positive COVID test, or when the employee tests positive for COVID. It'd be really hard. I don't know how really an employee would prove that they are caring for a sick family member, unless maybe they had like a doctor's note or something from the sick family member's like primary care physician that stated that they had COVID or COVID-like symptoms.
This is Don Dressler. I just would add, that's why we suggest you have a form for an employee to request exclusion pay. And on the form, it would have, and we have samples of those, why they want the exclusion. So at least they're having to put in writing the relationship and who they're caring for, because our expectation is people will be a little more honest if they know what's in writing and being recorded.
Well, actually, yeah, before you move on, Jake, Kayla and I have been working on a request for COVID type of related time off form, and where the employee would check the reason for the request for the time off, be signing at the bottom of the form that they're honest, they answered the questions honestly, and that there would be a consequence for being dishonest in the form. So we really would recommend that you get it in writing, and we have a great form for you to use. So contact your HR consultant if you need that. And we will provide that to you, and it will be a great thing for you to be able to make the employee jump through a hoop. And so it won't be so easy to lie. That if they're going to say that they're caring for a sick family member, they're going to put that to writing and sign their name to that.
All right, so this question here, can we get a copy of today's slides? If you guys would like a copy of the slides or the recorded presentation, you can send an email to info@calworksafetyhr.com. And the next question here, does an employee still need to make a verbal or written request for SPSL pay?
Yes, they would still need to make the verbal or written request. An employer couldn't just take, maybe an employee used some paid sick leave for a couple days. An employer can't just count that towards the SPSL unless the employee kind of either verbalizes it or requests them to actually take that from their SPSL bank rather than any kind of PTO or sick bank.
Do we need to continue asking employees for their vaccination status?
No. So you're no longer required to ask employees for their vaccination status. However, if an employer still wants to track that, they still can. They're still able to. We provide the vaccination tracking sheet if employers are still inclined to track vaccination status or booster status for their employees.
Does SPSL only apply to employees who contracted COVID in the workplace, or is it every employee that gets COVID regardless of where they got it?
SPSL, so yeah, it's regardless of where they got it. The COVID-19 in the workplace specifically, that's where exclusion pay comes in, or the benefit continuation, as Wendy had mentioned. SPSL is applied no matter where an employee contracted COVID.
Do we need to track vaccinations or boosters?
No, employers are no longer required to track vaccination or boosters.
Do you have a tracking form for those who have COVID, date of symptoms, date of tests, contacts?
I think we had created a draft form. I don't know if we had finalized it just because we weren't sure if clients would want that. However, if clients are interested in a form that tracks those who have COVID and symptoms and tests and everything, we can create something like that. We do have the investigation sheet, which might also be helpful, where kind of goes through who had COVID, when they had COVID, and close contacts for that specific person, but we don't have any kind of spreadsheet currently set up for any multiple COVID infections. But we do have a worksheet that we can give clients that goes into detail about how they can complete their investigation process.
All right, do we have any more questions? Perfect.
If we have a break, Jake, I'd just like to give an announcement to remind people. We do present webcasts the third Thursday of every month. And the next month's presentation will be Thursday, July 21st at 10 a.m. And our guest speaker will be Mike Gelman, who will talk about understanding and navigating company cultures and the current irrational behavior of employees or clients we now see at work. So I think you'll find he's a great speaker and very helpful. And also, just to give you a further heads up, on August 18th, Thursday at 10 a.m., we will do a presentation on active shooter incidents and workplace violence prevention. And just to this month, the Cal OSHA is circulating a proposed regulation that could be effective this fall that will require all employers to have a written and very detailed workplace violence prevention plan. So we'll be able to discuss that on August 18th. But we're also able to help clients with that if they have questions. Thank you.
Great. Thank you. This is an important topic. Remember, if we didn't address your questions today, go ahead and reach out to us at info@calworksafetyhr.com. Again, for the video recording or a copy of the slides. Be on the lookout for our future topics. And thank you for joining us. Stay safe, healthy, and have a wonderful day.